How are you doing today?
I'm pretty good.
Good?
My jaw and my wrist are kind of hurting, but...
Okay. Well, first, my name's Chelsea. I'm going to be your nurse.
Okay.
But your jaw, you said your jaw and your wrist are hurting?
Yeah, they've been bothering me.
Would you say, how does your pain rate on a scale of 1 to 10?
Probably about a 5.
About a 5?
Mm-hmm.
Okay, so I can speak to the doctor about your pain and, some things we can do for that.
Okay.
How's everything been since the car accident?
I've been feeling kind of sad. I don't really get out much. I haven't been talking to my friends, and I've been arguing with my husband a lot.
Mm-hmm.
We don't really talk.
Mm-hmm. Okay. Why do you think you haven't been getting out? Why do you think you've been arguing?
I don't know. I just mostly feel like staying at home, and I don't really feel like talking to anyone that much.
Okay. So, let me see. How do you feel? So, is it okay with you if we talk about alcohol and substance use right now?
Sure.
Okay. So, do you drink alcohol?
I do.
You do?
Mm-hmm.
Do you use any other substances or do you smoke?
No.
Okay. How often do you drink?
Probably every day.
Probably every day?
Yeah.
How much do you drink when you do?
I take shots of gin, usually maybe like 6 or 7.
6 or 7 shots a day?
Mm-hmm.
Okay. And when you say a shot, you mean it probably looks like this picture right here?
Yeah, I use
out of
a
the shot glass?
Yeah.
Okay, so about 1.5 ounces per shot. So let me see. So you're drinking 7 days a week, between 6 to 7 shots a day, but you don't smoke tobacco, you don't use any other substances.
No, I don't do that stuff.
Okay. So how do you feel about your drinking?
I feel like it helps me be a lot less nervous, helps me kind of deal with my stress, and it just makes me feel better usually.
Mm-hmm. So have you always been kind of stressed out?
I've always been stressed out. I started drinking more in the last 18 months, probably since the accident.
Okay, so it's increased some in the last 18 months.
Mm-hmm.
So what are the good things you would say, what do you enjoy about drinking?
It just makes me feel a lot better. I don't get as stressed out, and it kind of helps me deal with the fact that I barely talk to my husband.
Mm-hmm. Okay. So what do you think some of the negative effects of drinking are?
I like staying at home a lot more. I don't get out much. I used to play soccer and go climbing, but I don't really feel like doing that anymore. Mm-hmm. I don't really even talk to my friends.
Mm-hmm. Okay. So you mentioned your relationship with your husband. Do you feel safe at home?
Yeah, I feel safe.
You do? Okay. So do you think there's a connection at all between your drinking and the fact that you're not really speaking to your husband and you haven't seen your friends?
They don't know how much I drink. I don't really tell anyone, but I think it probably definitely makes me act different.
Mm-hmm. Okay. So do you feel like you need to make a change right now? How ready do you think you would be?
I would be willing to try.
Okay.
To make a change.
Okay, so based on what you've said so far, I'm going to go through this other questionnaire that's about alcohol use. That's okay with you?
Sure.
Okay, so I'm going to go ahead and use the audit tool right now.
Okay.
How often do you have a drink containing alcohol?
Most every day.
Every day, so 4 or more times a week. How many drinks containing alcohol do you have on a typical day when you start drinking? You said between 6 or 7?
Yeah, like 6.
6? Okay, so most of the time it's 6.
Yeah.
How often do you have 6 or more drinks on one occasion?
Pretty frequently, 5 to 7 days.
Okay, so daily or almost daily. Yeah. Okay. How often in the last year have you found that you were not able to stop drinking once you'd started?
I can stop when I want to. I don't seem to have that problem.
Okay. And how often during the last year have you failed to do what was normally expected from you because of drinking?
Occasionally, not too often. Maybe
okay.
Once a month or something.
Okay. And how often during the last year have you needed a drink first thing in the morning to get you going from a previous night of heavy drinking?
Maybe like half the time.
Half the time, so weekly?
Yeah.
Okay. How often during the last year have you had a feeling of guilt or remorse after drinking?
I feel guilty sometimes.
Sometimes?
I don't tell anyone about my drinking yet.
So weekly, you'd say? Okay. How often during the last year have you been unable to remember what happened the night before because you had been drinking?
I don't black out over it.
Okay. And have you or someone else been injured as a result of drinking? Okay. And has a relative, friend, or doctor or another health worker been concerned about your drinking or suggested you cut down?
No, most people don't know.
Okay, so this is the first time you've really told anyone or a healthcare worker about your drinking?
Mm-hmm.
Okay. So based on this score, drinking's a little bit problematic. You scored above an 8, which is an indication of hazardous drinking.
Oh, okay.
And you actually scored above a 13 as well, which could be reflective of alcohol dependence.
Okay.
So we want to maybe discuss cutting down. I understand this might be a little bit uncomfortable, especially considering this is the first time you've told anyone.
Yeah.
So I appreciate you being honest with me.
Thank you.
So some of the problems that can happen from drinking alcohol like this is you can cause cirrhosis of the liver, some pretty significant liver damage. It's probably contributing to your hypertension, and it can cause gastric ulcers.
Oh, wow.
It can cause nerve damage. It can cause a lot of health problems. So
Okay.
I'm going to go ahead and get you some more educational material on all that.
Okay.
And this educational material is also going to have sort of different facilities that you can contact for treatment options,
Okay.
like support groups, AA, should you be interested in that.
Okay.
And so I just to summarize real quick, it sounds like your alcohol consumption has increased in the last 18 months since the car accident.
Yes, I would say so.
And we think it's related to the high, or it's not related to the high blood pressure, but it's potentially causing your elevated blood pressure. And how ready for change would you say you are?
I'm fairly ready. I wouldn't say I could quit all the way.
Okay, so you're open to modifying, maybe not quitting.
Yeah,
Okay.
I can definitely try.
All right, so let's see. So on a scale of 1 to 10, 1 being not ready at all and 10 being completely ready for change, how ready do you think you are?
Probably a 5.
Okay, well that's good. That's, ready for some modification. It's about a 50% ready for change. Let's see. How confident do you think you would be able to pull off this change?
Maybe also like a 5. I think I could do it, but it'll be pretty hard.
Okay, well that's good though. And again, we're not looking to eliminate completely because, we don't want to do something that's completely unattainable.
So I can
do
just cut
something
back?
that's successful. Right.
Okay.
So we can cut back. So the recommended drinking guidelines for women is 7 drinks per week or 3 drinks per occasion.
Okay.
So considering you drink every day, if you want to continue that, then definitely only 1 drink per day.
Okay.
If you want to not and maybe save it for a weekend night, then definitely no more than 3 drinks per occasion, okay? I know that seems like a pretty significant change, so probably I would recommend having the 1 drink every day since drinking every day seems like such a routine for you. That sounds more attainable to me, at least. How do you think that sounds?
I think that sounds good. I think I could definitely cut back to that if I tried.
Okay, well good. So let's see. That's my advice, and I'm glad that it sounds like you're ready to go there. So we have a goal of about 1 drink a day, 7, adding up to 7 drinks per week. So I'm going to go ahead and get that educational material for you, and I'm going to discuss with your doctor about some potential treatment options and get you more education about that as well. And we're going to arrange for a follow-up in about a month, okay?
Okay, sounds good.
Okay, great.
Thank you.
I can cut this out.